Let's talk about a disease called acute lymphocytic leukemia. Acute lymphocytic leukemia is a type of cancer of bone marrow and the blood. It progresses rapidly and creates immature blood cells rather than mature ones. Acute lymphocytic leukemia is also known as acute lymphoblastic leukemia. The symptoms of acute lymphocytic leukemia may include bleeding from the gums, bone pain, fever, frequent infections, frequent or severe nose bleeding, lumps caused by swollen lymph nodes in and around the neck, armpits and abdomen, pale skin, shortness of breath, weakness, fatigue or decrease in energy. Let's discuss about its causes. Acute lymphocytic leukemia occurs when a bone marrow cell develops changes in its genetic material or DNA, in a process called mutation. Normally, the DNA tells the cell to grow at a set rate and die at a set time. In acute lymphocytic leukemia, the mutations tell the bone marrow cell to continue growing and dividing. When this happens, blood cells production becomes out of control. The bone marrow produces immature cells that develop into leukemic white blood cells called lymphoblasts. These abnormal cells are unable to function properly, and they can build up and crowd out healthy cells. Factors that may increase the risk of acute lymphocytic leukemia include previous cancer treatment, children and adults who've had some types of chemotherapy and radiation therapy. For other kinds of cancer may have an increased risk of developing acute lymphocytic leukemia. Exposure to radiation. People exposed to very high levels of radiation, such as survivors of a nuclear reactor accident, have an increased risk of developing acute lymphocytic leukemia. Genetic disorders. Some genetic disorders, such as Down syndrome, are associated with an increased risk of acute lymphocytic leukemia. Stages of treatment. Treatment for acute lymphocytic leukemia is usually done in 3 stages. Stage 1. Remission induction. The aim of remission induction is to kill the leukemia cells in the bone marrow, restore the balance of cells in the blood, and relieve the symptoms. Stage 2. Consolidation. This aims to kill any remaining leukemia cells. Stage 3. Maintenance. This involves taking regular doses of chemotherapy medicines to stop leukemia coming back. Stage 1. Remission induction. The remission induction stage of treatment is done in hospital. The patient will need regular blood transfusions because the blood contains no enough healthy blood cells. Stage 2. Consolidation. The aim of consolidation treatment is to ensure that any remaining leukemia cells are killed. The consolidation phase involves regular injections of chemotherapy medicine. The consolidation phase lasts several months. Stage 3. Maintenance. The maintenance phase is a further step to help ensure the leukemia does not come back. It involves taking regular doses of chemotherapy medicine while having regular checkups to monitor the treatment. The maintenance phase can often last for 2 years. So, take care of yourself. We'll come in the next video with the next topic. Hope you like the video.
Do subscribe the channel for more videos.